As China grapples with COVID-19, a massive outbreak, the situation has gone from bad to worse when it comes to antiviral drugs. A limited supply and rising prices of the two COVID-19 antivirals have driven many Chinese to opt for cheaper and illegal imports from India. Now, both antivirals, which are Pfizer's Paxlovid and Azvudine, are not available in hospitals, which has driven many Chinese residents to search on social media platforms for other antiviral drugs from India. Now, topics like anti-COVID generic drugs have been trending on Chinese social media platforms such as Weibo, with users exchanging messages to get hold of the medications. Now, while the Chinese have been searching for Indian generic drugs, it's to be noted that we are essentially going to be getting some more information about this, because this is an exclusive expose when it comes to the fact that the Chinese are now turning to the black market to get Indian drugs to battle the surge. Now, what we know is that there are four kinds of generic anti-COVID drugs from India which are being illegally sold in the Chinese market. Specifically, the brand names that we're aware of are Primovir, Paxista, Molnunat, and Molnatris as well. Now, what we know about the pricing is that while Paxlovid is priced at around 2,981 per box, a box of Indian-made drugs can be bought for around a cheaper price, around 530 to 1,600 yuan. Now, I am crossing over to CNN News 18, Siddhant Mishra, who's going to be joining us live. Siddhant, can you first tell us what details we have about this entire racket, about this black market where the Chinese are turning to essentially get more medication to battle COVID?
Well, look, it has again been proven that China infects, but India injects. So the virus, which has been given to the world by China, and this is not what we are saying, this is what United Nations reports say, this is what US has been saying, that this virus has come from China. So this virus, which has caused lives all across the globe, is now creating trouble for China and India. Indian generic medicines are the only healing tablets for Chinese population. Now, the report that we have accessed, tell us that there are approved COVID-19 antivirals, Pfizer, Paxlovid, Azvudine. So these are the two antivirals which have been approved by the Chinese government. But because of the steep price and shortage in supply, the Chinese population is relying more on Indian generic drugs. And in fact, these drugs are available in the black market, and especially in dark web on cyberspace. So people in China are procuring these medicines through dark web. And in fact, there are some channels through which these Indian medicines are being.
All right, we're going to try to reestablish that connection to get more information, but essentially what we also do want to point out is that public health experts and doctors in China have warned of the potential risks, and they've also urged people of China to not buy this medication when it comes to buying it from illegal channels, including unlicensed salespeople, especially when they're using social media platforms to buy these medications. I'm crossing back over to CNN News 18, Siddhant Mishra. Siddhant, please continue.
Well, yes. So I was highlighting that only two drugs have been approved by the Chinese government, and since these two drugs are in limited supply and due to steep price, the common people in China are unable to buy this drug. So they are relying mainly on the Indian generic drugs, and four kinds of generic anti-COVID drugs from India are being sold illegally in the Chinese market. Primovir, Paxista, Molnunat, and Molnatris. So these four kind of drugs are being sold, and we have also been told that approximate cost of these drugs are 1,000 yuan, which is US dollar 144. So these drugs are available on darknet, and there are other illegal channels through which these Indian drugs are being sold in China. So China has given relaxation to the population, and this is perhaps the reason the numbers are rising. Till this point, China had claimed that their COVID management policy was best in the world. the way restrictions were imposed, the way, lockdown was imposed across the country, because of which COVID did not spread. But now the relaxations have been given, and the same policy, the policy of the same, the weakness of the same policy is now coming out and is being exposed. That they have to rely on Indian generic drug. Their population has to rely on Indian generic drug. So basically, if a medicine is not approved from the government in China, then if you are buying it, then you will not be penalized. But the person who is involved in selling it or buying it in bulk and selling it through illegal channels can be penalized. So this is a situation of China. But once again, China infects and India injects. The way Indian medicines have saved lives across the globe, this time around, Indian medicines are saving lives in China. And this is not we are saying, this is what the reports have been telling us, that how Indian antiviral drugs are popular in Chinese market. And where I remember when Xi Jinping was going to take over for the third time, there was a propaganda advertisement given in every country across the globe by the Chinese government, that what all they have done in COVID times, how they saved their people, how they saved lives, and how their COVID policy was best in the world. But this time around, when COVID numbers are rising, they are unable to provide medicines, antiviral drugs to their own people. It again exposes the administration of the Chinese government, that they were not prepared for it, and they are unable to provide medicine to their own population. Also, Chinese government claims that there are less number of deaths in the China. They also say that there are less number of COVID infected people. But many believe, in fact, many world organizations believe that this data, these numbers which China is projecting, which China is providing, is not correct. The number is rising in China, and there is a high possibility that China is going to see bad times as far as COVID is concerned in coming months.
Siddhant, do we have any timeline when it comes to when Chinese residents have actually started turning to the black market? Because as we know, China also tends to be one of the largest manufacturers of medication. The fact that they're now being forced to turn to the black market speaks volumes about their current economic situation. Can you tell us more about that, please?
Well, look, even if you are a manufacturer, then the drug should reach every household. That is a responsibility of a government. In India, the way a vaccination has been done, the camps were organized. It was implemented at each and it was implemented on ground in a right manner. People got vaccinated easily. There were doses which were already arranged by the government. So there was a proper strategy in place. But in China, it looks like that they were not prepared for such situation, and this is the reason that despite being one of the biggest manufacturers of drugs in the world, they are unable to provide antivirals. They are unable to provide medicines to their own population at a cheaper rate. So it again exposes the Xi Jinping government and the way and how they were not prepared for this situation.
Absolutely, Siddhant. Thank you so much for bringing us all of that information. Now, with this